Indonesia has expanded nationwide coronavirus curbs to ease the strain on hospitals. The country is battling its deadliest wave of COVID-19. The new restrictions will apply to dozens of cities, stretching from Sumatra Island to West Papua. Until now, only Java and neighbouring Bali were covered. Now, more than 34,000 infections and over 1,000 deaths have been logged, a new record. Hospitals are running out of oxygen as they become overloaded by patients.
Dari awal kita itu supply itu standar 100 ke atas, bahkan dari kemarin menurun. Sampai sekarang pun kami dikirim cuma 60 tabung. 60 tabung betul ya. Mungkin besok sudah ada lagi. Kendalanya sekarang yang informasi yang saya dapat, bahkan yang dari Cikarang kita punya untuk supply kita dari Sentosa Cikarang, itu sudah banyak rumah sakit yang langsung ke lokasi.
Untuk rumah sakit itu kalau bisa yang udah positif itu harus diterima lah, jangan kakak saya masalah di sana penuh sini penuh, cuman kita juga bingung kan kalau di rumah dirawat di rumah, kita juga belum ngerti gitu. Saya pengennya sih untuk pemerintah untuk untuk kesehatan juga alat-alat kesehatan untuk di ini lagi deh semuanya ya.
Let's go live to Jakarta, where Saiful Bara Ismail joins us. Saiful, Java remaining the epicenter of the outbreak, and authorities seem reluctant to take any chances.
That's right, Jill. Authorities are definitely not taking any chances. The curbs being imposed in areas outside Java and Bali are called tighter micro-scale public activity restrictions, or tighter micro-scale PPKM. Essentially, these are just partial lockdowns. However, this is different and less strict as compared to the emergency public activity restrictions, or emergency PPKM, imposed on Java and Bali. Authorities are taking such an action because there has been an overall 34% increase in active COVID-19 cases in areas outside Java and Bali. Now, the increase in active cases varies across different provinces. Some of the provinces have recorded really high increases in active cases. For example, North Maluku recorded an increase of 160%, and West Papua saw an increase of 155%. Regional leaders have been urged to implement curbs, including measures to ensure offices and malls operate at 25% capacity, and for restaurants and malls to close by 5 p.m. So the government is introducing tighter curbs now before the COVID-19 pandemic in those areas really gets out of hand, before hospitals really get overwhelmed, and more importantly, to prevent those provinces from becoming what is currently happening in Java and Bali right now. The government is monitoring daily cases and bed occupancy rates in 43 areas deemed higher risk red zones until July 20th. Authorities said that it will not rule out the possibility of escalating the curbs to emergency public activity restrictions like what has been introduced in Java and Bali.
And how are Indonesians reacting to these latest changes? And has the government indicated any possible relief measures to accompany them?
Well, Jill, generally people understand the need to impose these tighter movement restrictions. The pandemic is not exclusive to Indonesia. It is a global phenomenon. The government is rolling out new rounds of social aid to support people affected by the latest emergency public activity restrictions across Java and Bali. These will probably be given to residents outside Java and Bali when authorities decide to increase the level of restrictions. Now, the government said it would be giving out direct cash transfers to needy residents. It has set aside an additional $421 million from this year's budget to extend the program until August. The direct cash transfers will be for some 10 million beneficiaries in the next 2 months. However, observers have called for more transparency in their disbursement following a graft scandal relating to a similar aid last year. Authorities said that data used for disbursement is much more accountable as compared to last year. They've also called for the public to closely monitor the aid disbursement, saying social control from the public was the most effective form of control.
Many thanks, Saiful Bahri Ismail in Jakarta. Now, as you heard, the worsening outbreak in Indonesia has led to an oxygen crisis. We're going to take a look at how hospitals potentially could buckle under that strain. More on that story later in the bulletin.